With updated COVID-19 vaccines now available, there's a lot of confusion about the right time to get a vaccine. As we head into the busy holiday season, it's important to have a plan in place to keep yourself
Sure.
and your loved ones healthy and focused on the joy of the season.
Joining us to offer his insights, staying safe, of course, this holiday season is former U.S. Surgeon General Dr. Jerome Adams is joining us. This segment sponsored by Moderna. Dr. Adams, thank you so much for joining us.
Really great to be with you.
Let's talk about this. What is the latest information that we need to know about the current COVID situation?
Well, important to understand that the CDC said hospitalizations are increasing, 16,000 last week. And while thankfully we are out of the worst days of the pandemic, it's important for the public to know that COVID-19 remains a public health threat, and that just as we do every year for flu, RSV, strep, we're going to see rising levels of infection and hospitalization during the winter months. People come indoors, people close the windows, they're tighter together. But also co-occurring with the holiday season, people are traveling, they're encountering folks from all over the country. And also we're running into people who may be vulnerable. We're going to visit grandma, we're going to visit people in nursing homes, people who are immune compromised. So for all those reasons, we're going to see infections go up, we're going to see hospitalizations go up. And we need to be thinking about what our personal plan is to stay safe and to keep our loved ones safe.
Sure.
Yeah, certainly. Why do you think it's important to get vaccinated before the holidays?
Well, we know that it can take a few days up to a few weeks for you to build up optimal immunity once you've been vaccinated. We know that most people out there had not received the vaccine in well over a year. And just like you get a regular flu update for new flu strains, it's time to get updated for these currently circulating COVID strains. The sooner you can get in, the sooner you're going to be able to be optimally protected. And I want to remind people, you don't have to go into a doctor's office. If you have a question, certainly call your doctor or nurse. Don't rely on online information or social media information. But you can go into your pharmacy. You can ask your pharmacist questions and you can get a vaccine. I got my kids vaccinated just last week at the local CVS. But again, we want to make it as easy as possible for people to make a healthy choice this holiday season.
Yeah, absolutely.
Yeah. What age groups would you say are most at risk for these viruses?
Great question. We know that 90% of the deaths are occurring from COVID-19 in people over the age of 65. If you're a viewer and you're over 65 and you're not updated on your vaccines, please listen to me. It is imperative that you talk to your doctor, your health provider, and make sure you all are having a conversation about getting vaccinated. You are at highest risk. We also know people who have diabetes, if you're on insulin, taking diabetes medication, people who have lung issues, if you're taking an inhaler for asthma or COPD, or people who have heart issues are at higher risk. Those are the folks we most want to make sure are up to date on vaccines, in addition to any loved ones you have in a nursing home. A shocking stat, CDC said less than 14% of people in nursing homes, who we can all agree are high risk, have received their updated COVID-19 vaccines. And that's why you're still seeing hospitalizations and deaths rise, even though we have more tools than ever to protect ourselves.
Sure, absolutely. Here's a question, Dr. Adams. Let's just say if I had COVID in the spring or summer, do I still need to get, an updated vaccine, or will those antibodies produce, are they still fighting the virus to protect us, through the winter season?
That's a wonderful question. Important for people to understand. Immunity from prior infection is not enough. Now's the time to get your updated COVID-19 vaccine. Most people who were infected in that late summer, early fall surge. And the CDC says that you should delay your vaccine by 2 to 3 months after last symptoms. So now literally the perfect time for you to go and get that updated vaccine. It's been shown that people who were infected and then vaccinated had lower risk of reinfection and hospitalization than people who were infected and did not get an updated vaccine. So great question. Talk to your doctor if you have questions. But yes, it's recommended that you still get vaccinated even if you had an infection in this past year.
Sure, absolutely. Dr. Adams, where can, our viewers go, as we're making those personal plans like you talked about to get more information about vaccinations?
Most important thing you can do is talk to your doctor if you have questions, but you can go to vaccines.gov. Great place to get information. You can also check out my new book, Crisis and Chaos. It's got great tips on how to stay safe from COVID-19, how to assess your risk, how to identify misinformation and disinformation. But it also has some really fun stories in there about conversations I had with Oprah Winfrey during the pandemic, Chef Jose Andres, even Axl Rose. I try to make staying safe fun. And that's what we want people to do. Have fun this holiday season by protecting themselves. Get the facts, and hopefully you'll consider getting your vax, both flu and COVID-19.
Yeah.
Dr.
great.
Adams, thank you so much
Thanks,
for
Dr.
joining
Adams.
us today. Have a good holiday.
Yeah.
Thank you. You all too.
Thanks so much.